Today, I will be using a causal informative speech to discuss non-opioid alternatives to pain management techniques. The use of non-narcotic pain management techniques can provide additional effective pain management and can help to reduce the amounts of narcotics used in the post-operative setting. You've gone to your doctor for a nagging pain that just won't go away. Now your doctor is telling you need to have surgery to correct the problem. This is never the news that anyone wants to hear. The typical patient arrives to the hospital prior to surgery with a heightened level of anxiety in anticipation of the pain that normally follows. Expectations of some discomfort are very normal. According to Garamilla and Cellini in their article, Postoperative Pain Control, the goal of postoperative pain management is to relieve pain while keeping side effects to a minimum. This is often best accomplished with a multimodal approach. Today we will be discussing the various facets of an effective multimodal approach to pain management. As an RN at an orthopedic hospital, I have personally witnessed the positive outcomes from the use of multimodal techniques. As I also learned during my research, this includes preoperative non-opioid medications, alternative pain management techniques such as nerve blocks and spinal anesthesia, and relaxation techniques such as medical hypnosis. And finally, engaging the patient's participation in their own care to ensure the best possible outcome. The multimodal approach to pain management has been developed to allow patients a more interactive part in their own care and their own personal outcomes. This multimodal approach is now including more alternative pain management techniques. As described in OrthoInfo, alternative methods to help manage pain after orthopedic surgery, new pain control techniques are used as a supplement to, and sometimes even a replacement for, more traditional techniques. Poor postoperative pain management can lead to complications such as chronic pain. Chronic pain can lead to a reduction in the quality of a patient's life. People with chronic pain that rely on medications can also become addicted. And chronic pain can lead to additional complications, such as extending the length of a patient's rehabilitation. Preemptive analgesia is a method that is employed preoperatively using non-opioid medications. The conventional wisdom behind the use and subsequent overuse of opioids for pain management has changed. Opioids are still used, but they are not necessarily used in the large doses that were formerly required. Drs. Garamilla and Cellini from the Department of Surgery at the University of Rochester Medical Center also write that preemptive analgesia is often used to bring the patient to a therapeutic level of non-opioid medications in their bloodstream. Tylenol is one such of these medications. It is given the day before surgery for a max dose of 3,000 milligrams. It is also given the day of surgery, even during surgery, for another 1,000 milligrams. After surgery, Tylenol is given on a regular schedule for the first 24 to 48 hours. This is done in order to maintain the therapeutic level and to allow for more effective pain management sooner. No more riding the roller coaster of up and down pain management. Other medications can also be used with effective outcomes. Anti-inflammatories like Celebrex and steroids such as dexamethasone, they're used to jumpstart the anti-inflammatory process. Steroids are effective against inflammation, but they also serve to potentiate the duration and good effects of other medications. Additionally, anti-nausea medications like Zofran and Phenergan are given preoperatively and again during the procedure, because the last thing that anybody wants to have after surgery is nausea. In addition to effective preemptive analgesia, nerve blocks are another alternative pain management technique that is performed in the preoperative setting, and it can provide significant long-term pain management. According to the article, Alternative Methods to Help Manage Pain After Orthopedic Surgery, the use of nerve blocks often you can remain conscious during the procedure and require only light sedation. Other times, regional blocks may be used as a supplement for general anesthesia. Either way, you will have little to no pain when you wake up. Regional nerve blocks target the specific nerves that are going to be affected by the surgery. They are designed to last for up to 24 hours. An implanted catheter can also be placed at the site, allowing for continuous medication administration for an additional 3 to 4 days. Regional blocks are performed by the anesthesiologist prior to surgery. This technique allows for maximum post-op relief immediately upon waking from surgery. It also can decrease the need for narcotics in the immediate postoperative setting. Use of techniques such as nerve blocks can empower the patients and positively affect their ability to participate in their care. In the article, Patients and Nurses' Attitudes Towards Pain Management with Alternative Methods, pain should be managed by combined conventional and alternative interventions, and patients' opinions should be taken into account. With that in mind, the new multimodal approach to pain management encourages the patient to take a more interactive part in their own care and personal outcomes. This multimodal approach is now including more alternative pain management techniques. Relaxation techniques can also provide pain relief. These techniques include reducing environmental stimulation, medical hypnosis, and musical therapy. In conclusion, avoiding a poor outcome is the ultimate goal. According to Garinelli and Cellini, the failure to provide good postoperative anesthesia is multifocal. Finding alternatives to the traditional opioid-led pain management techniques has changed the way pain management in a hospital setting is provided. Following a multimodal approach inclusive of techniques such as nerve blocks and preemptive analgesia is improving patient outcomes. According to the study published in Progress in Health Sciences, almost 75% of participants state that they would suggest an alternative method for pain management. Hospitals, surgeons, and nurses are constantly looking for more cost-effective multimodal alternatives that also include relaxation techniques, medical hypnosis, and the use of non-opioid medications in order to better maximize patient satisfaction. When these alternatives are combined in the right sequence, better, more cost-effective outcomes exist for both the patients and the facilities that provide their care. Empowering patients in their own care can also lead to better overall satisfaction and improved outcomes. So the next time a doctor tells you or a loved one that you need to have surgery, ask about alternative pain management techniques. Together, you and your doctor can work up a multimodal plan of care that you both agree will work best for you and your personal needs.